Hi, this is Dr. Terry Frankovich.
Thank you very much. So regarding the two positive cases announced yesterday, March 26th, can you tell us if they're related to the international traveling group or if public health has determined any other positive points of contact?
Well, those individuals are not related to this traveling group, and the contact investigations are ongoing at this time, so we'll keep people informed.
Thank you. Do you intend on extending the shelter-in-place order or adding more restrictions to align more with Mendocino and Trinity Counties' orders? For example, closing county beaches, trails, or closing county borders to non-residents.
So when we put this order in place, we obviously looked at the existing orders all over the state of California, and most counties are modeling those. Also, counties that put them in place earlier have had some lessons learned. And so we're clearly looking at all of those again and seeing if there are areas that we can adjust or make clearer for individuals, because I know clarification has been an issue among the public. And so if there are ways that we can improve that order, that's important to us. And the other issue is, of course, that we are continuing along this progression with shelter in place and our efforts to curb this epidemic. And so if there are things that we can enact that would help us do that better, we're looking at that as well.
Thank you. How many ventilators are available in the county at this time, including in Southern Humboldt?
So obviously working with our hospital partners is a huge piece of this in preparing for an eventual increase in cases needing medical care, including advanced medical care with ventilators. The hospitals are all being very active about identifying what they have in current ventilator capacity, what alternative ventilators can be used. For instance, the operating rooms always have ventilators. So that can add to our stockpile. There is technology that allows ventilators to be used between more than one individual. And so that is also being looked at in addition to just increasing our supply locally, because as we watch all of the other areas that are involved, ventilator and ICU capacity is critically important.
Thank you. Is Humboldt County working to get any more ventilators to increase our surge capacity? And would the county send any equipment currently here, including masks, ventilators, and tests, to other areas that need immediate relief, such as New York?
Well, what I would say is obviously we are looking to increase capacity here in all of the equipment that we need to support more hospital and ICU care. So that's a given in this situation and is part of our advanced planning. In terms of sending things elsewhere, I would not envision that at this time, since we are seeing increasing cases across the state of California. And so we're really focusing on preparing our local area for what we're going to need.
Would the county mandate stricter shelter-in-place restrictions if this virus continues to spread locally? And where is that point? Is it a specific number of county cases?
So it's not necessarily a specific number locally, although that certainly is an indicator for us looking at what we're doing and whether there's something additional we can do. We're also looking in other areas, again, lessons learned in other parts of the state. So we basically take that whole wealth of information and try and craft things to support what we need to do. So again, one other piece of that is we look at how people are interpreting and acting based on the orders and whether we need to do anything to sort of decrease risk behavior.
As far as tracking down the passengers on any of the 3 United flights, is there a passenger list that you're able to access to make sure each traveler is contacted about exposure, and what's being done specifically to inform each passenger that was on the infected flights?
So this comes up in other instances, not just COVID, and things like measles and such, when we have to identify a flyer who may have been infectious at the time they flew. So the protocol for this is quite specific. The protocol is that the federal agency is contacted with the flight information that we have. They actually, I believe, reach out to airlines, passenger lists are generated, and then those are made available locally. The issue we're finding, at least at this current time, is that system is slow. And so we have been looking, when timing is critical, we're looking at ways to really try and just get to the population on a plane before that comes through. And that's why we put out the media release. We realize it's not a perfect solution because there's no way to be certain that every person will get some piece of the media announcing this. But I think under the circumstance, it really has been the best we could do. Now, clearly, we're working on whether there are ways we can expedite that process, but right now that has been our tool. And unfortunately, again, probably because of demands on the system, it hasn't been quite as responsive as we would like it to be.
Thank you. Why are you not able to provide more information on the age range or gender of each person that's infected with COVID-19? Also, why can't you provide the city where each person is from?
Sure. So, and I get the idea. People have an obvious interest in this, and I understand that. And certainly some large cities and areas in the country, and including certainly the national statistics that are put out, identify those types of factors. Not the city of location, obviously, but age, gender, that type of thing in terms of the cases presenting. The problem we have in small communities is that, for instance, if we identify a child, and there's one child, in a small community, it's much easier to sort of identify who that person might be. So in small areas like ours, we tend to be very careful about that. My expectation is that as our number of cases increases and we have some meaningful local data about that, we will make that data public. But right now, when we have a relatively small number of cases to report, it becomes more difficult to maintain some confidentiality and do that. In terms of cities, I understand the desire to have that information, but I do ask that people think about why that information is important to them. What we have in place, we have shelter in place going, right? So everyone is asked to be at home unless they're essential workers. We have recommendations in place about frequent hand washing, about social distancing, all of those things that are already constructed to help keep distances between people. What I can tell you is that at the current time, there is no more risk to you if an individual lives in your town or the town over. And so there's no public health benefit to identifying people by their place of residence. And if there's some instance in which that is not true, we are able to share that information. But in this instance, it is not.
Thank you. What is your biggest priority right now in preparing for coronavirus?
Well, I think there are really two pivotal things strictly from sort of the internal public health viewpoint. Obviously, there are lots of concerns for the county as a whole. But for us, I think one of the main areas is our contact identification and then quarantining contacts or having them tested if they're symptomatic. That's a huge piece of, again, trying to put the brakes on spread within our community. And contact investigations are extremely labor intensive and they do take some time. As you can imagine, for every case that you identify, as you walk through where they have been during their symptom period, particularly since some people may have milder symptoms at the outset, we need to look at their home place, at their workplace, all of those instances of where they have been circulating in the community, and it takes time to build that tree of who those contacts are that might be considered close contacts and are important to identify.
How are you reassigning staff to tackle it?
So, and just to clarify too with the second area that I was talking about with the previous question is that the second issue is surge capacity, is what we call it in public health. So it's that broad scale work of trying to make sure that our facilities are all sort of getting what they need to be ready and involved in their preparedness as well, looking at not only the individual facilities, but how we all work together. If there's a regional demand, how does EMS work in that system? How can we make that work better when we're starting to look at moving people between places? So I think that's all part of our planning now, as well as the equipment that people have referenced in questions. Ventilators, all of that needs to be in place. And so it's a huge piece of the work that we're doing right now and is a huge priority for us and our partners.
Thank you. How are you, why is it taking so long to determine whether that one case, the fifth, was acquired through community spread, and how will the county's safety measures change once community transmission is confirmed?
Well, what I would say is that in this instance, of course, as we talked about, contact investigation is complicated. And each individual that you interview can sometimes change the picture a little bit of what you're seeing. So before we make that determination of community transmission, we're trying to be very careful about understanding whether there's any possible contact with a case, any travel that may have happened. And so we're just trying to be very thorough before we make the leap to that. I will tell you that the 5th case that we identified has actually turned out to be the contact of a case and is not community transmission. However, we are still working on contact investigation on the 2 individuals identified yesterday and sorting through all of that information as well. So again, we'll keep people posted as we learn more.
Thank you. Can you ask people to waive some portion of their HIPAA rights in order to provide information that would be helpful to the community?
Well, in general, I would say that we don't make that request of patients unless it's important information for the community. And in fact, if it's critically important to the community, it does not require that permission and to reveal some things about the case. So we take that very seriously. And just as I'm sure everybody in the county who is thinking about this issue appreciates the fact that their clinician, for instance, tells them what their health information is, but they don't broadcast that to the community. And I think by the same token, if that individual chooses to share that information, they can do that. That's within their rights. But the healthcare system has a duty and obligation to protect information that is private information unless there's a community value to doing that. And right now, that is not the case.
Thank you, Doctor.
Thank you.